Okay, I'm just going to close this curtain and wash my hands. My name is Suzanne. We're going to be doing a head-to-toe assessment on you. Can you tell me what your name and date of birth is?
John Copeland, 9/15/92.
Okay, I'm going to check that with your wristband. Do you know why you're here?
For head-to-toe checkoff,
Do you know what time it is?
it's about 2:30.
Do you know what today's date is?
It's the 23rd April 2016.
Okay, your comprehension sounds good, and your speech is good, and you're also oriented to person, place, and time. Is there any kind of cultural and religious practice that you need to know about before we get started?
Nope.
Alright, we're just going to start out by palpating your head. Alright, the hair looks evenly distributed, and it's soft to touch. I'm going to take a look at your temporal pulses now. Okay, your temporal pulses are 2+ equal bilaterally. I'm also going to check out your ears now. Okay, your ears look even, and there's no nodules or lumps or anything like that. And it looks like from your eyebrows to your ears is less than 2 degrees, so that's good. And then your eyebrows look like they're evenly distributed, and so do your eyelashes. I'm going to take a look at your conjunctiva. Your conjunctiva is pink and moist, and your sclera looks like it's white. Let's check your nose for patency really fast. Breathe in. Breathe in. Alright, the nose are patent, and we're going to do your sinuses now. Feel any pain in your sinuses?
Nope.
Alright, let's check out your eyes. I want you to look behind me. Now look at this. Accommodation looks good. Now look at me. Alright, your accommodation to light looks good. Let's also check your 6 cardinal gazes. So follow this pin. Alright, your 6 cardinal gazes look good. Let's look inside your mouth as well. Open your mouth. Alright, say ah. Say E. Alright, soft palate rises upon saying E. Teeth look white, and your oral mucosa is pink and moist. Let's check your lymph nodes now. Alright, put your head down. Okay, lymph nodes are not palpable. And I also need to check your trachea. Trachea is slightly movable, and the thyroid gland is not palpable. Alright, let's do some facial exercises. So I want you to smile. Now puff out your cheeks. And then frown. Alright, facial nerves look like they're intact. I also need you to stick out your tongue. And then put it to the side. And the other side. And then up and down. Alright, facial nerves are intact. And the thyroid is not palpable. Alright. The next thing we're going to do is we're going to take your carotid pulses. So, just going to take that really fast. Alright, your carotid pulses are 2+ equal bilaterally, and so are your temporal pulses. They're 2+ equal bilaterally. And alright, the next thing we're going to do, we're going to listen to your lung sounds. So I need you to sit up a little bit. Take a deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Okay. I want you to turn around. Deep breath. Deep breath. Deep breath. Deep breath. Okay, you can turn back around. I'm going to switch over to the bell now, and I'm going to listen to your carotids, and then I'm going to go back to your lungs. Hold your breath. Hold your breath. Okay, your carotids have no signs of bruise. Now we're going to listen to your lungs again, this time with the bell. Okay, turn around. Okay, can turn back around. This time I'm going to listen with the diaphragm again, but I want you to lift your arms up so I can get your sides. Take a deep breath. Take a deep breath. Deep breath. Deep breath. Now we're going to switch to the bell. Lift your arms up again. Deep breath. Deep breath. Deep breath. Deep breath. Alright, let's listen to your heart sounds now. We're also going to get an apical pulse. Okay, your apical pulse is 72. Now I'm going to listen with the bell for any signs of a murmur or anything like that. Okay, I don't hear any adventitious sounds and no signs of a murmur. So, next thing we're going to move on to, I'm going to check out your arms and we're going to do some range of motion stuff. Do you have any pain in your joints?
Nope.
Okay, it looks like your temperature is warm and dry and your skin turgor looks good on both arms. Your capillary refill is less than 3 seconds, and I don't see any signs of clubbing in your fingers. And capillary refill is less than 3 seconds on that one as well. Alright, so I want you to push your forehead against my hand now. Okay, now turn your head to the side. Another one. Now shrug your shoulders. Alright, let's do some range of motion stuff. Your muscles in your neck and your face look good, and they work fine. So, stick your hands out, palms up, palms down, turn them around. Okay. I also need to get a radial pulse. Alright, radial pulse is 2+ equal bilaterally. And your skin is warm and dry. And there's no clubbing in your nails, and your capillary refill is less than 3 seconds. Alright, let's get you standing up now. I'm going to take a look at your costovertebral angle of your ribs. Alright, your costovertebral angle looks like it's less than 90 degrees. And I want you to turn around. Turn this way. Alright, now take a deep breath. Alright, your lung expansion looks even. And take another deep breath. I'll turn this way. Okay, your breathing is unlabored, and it looks like you have a 2-to-1 AP diameter. So the next thing we're going to do is palpate your chest. So I'm just going to palpate your chest and feel for any abnormal lumps and masses. Turn around. Okay, I'm not feeling any abnormal masses or anything like that in your anterior and posterior chest. So now I want you to do some more range of motion stuff. So take your arms out, then up, and back down, and then forward, and then palms down, and then back up, and then back down, and then behind you. Okay, range of motion in your arms looks good, and then twist your wrists. Alright, now we're going to do your legs, so I want you to step forward a little bit. Alright, stick one leg out, and then back, and then the same with the other leg, and then back, and stick your leg out, and then back, and the same with the other leg. Up, and then back, and then behind you, and then back, same with the other leg. Now I want you to stick your right leg out, and put your foot up to your calf, and then back down, and point it down. Alright, you can put your leg back, and then the same with the other leg. Stick it out, and then point it up, and then down. Okay, your range of motion in your legs looks good. Now we're going to do some walking. So I want you to walk heel to toe towards the door. Alright, you can turn around and then walk on your heels. Okay, now I want you to walk back towards the door on your tippy toes. Okay, all of your range of motion exercises look good. Now we're going to do some muscle strength. So I want you to put your hands out like this, and then try to stay standing with me pushing you. Alright, now squeeze my hands. Okay. Your muscle strength looks good. So now what I want you to do is sit down on the bed. I'm going to take a look at your skin and everything. Your skin is dry and warm. And also, I'm not seeing any signs of edema or crepitus. And it looks like there's no clubbing in your toenails, which is also good. And your hair is definitely equally distributed. And your skin turgor on your feet looks good as well. Your capillary refill is less than 3 seconds. On both feet. That looks good. I don't see any signs of cyanosis or pallor, and there's no edema, so that all looks good. I need you to sit down, just lay down in the bed. Alright. I'm going to take a look at your legs, and I'm going to check for a Hohmann sign. So I'm just going to lift your leg up and put your foot towards your knee. And you tell me if you feel any pain in your calf muscle. You feel any pain?
No.
You feel any pain?
No.
Alright, that's negative for Hohmann sign. Now we're going to get some pulses in your dorsalis pedal pulse. Alright, your dorsalis pedal pulse is 2 plus equal bilaterally. Now we're going to do your tibial pulses. Your tibial pulses are 2 plus equal bilaterally. And I want to check for sensation on the bottom of your feet. So without looking, I'm going to strike your foot, okay?
Mm-hmm.
Feel that?
Mm-hmm.
You feel that?
Mm-hmm.
Alright, sensation in your feet looks good. And you're negative for Hohmann sign. Let's take a look at your jugular veins now, okay? So I want you to look that way. There's a pulsation, but I don't see any vein distension. Look this way. There's a pulsation again, but there's no vein distension. Alright, the next thing I'm going to do, I'm going to take a look at your stomach, so I want you to lift your shirt up. Okay, there's a little bit of striae, but there's no lacerations or anything like that. So, what we're going to start out doing, I'm going to listen to your bowel sounds, okay? Okay, your vowel sounds are present in all 4 quadrants, and now I'm going to listen for some vascular sounds as well with the bell. Okay, I don't hear any abnormal vascular sounds. So what we're going to do next is I'm going to palpate your stomach. Do you feel any pain in your stomach?
No.
Alright, we're going to start at light and then we're going to go deep. Okay, on light palpation there's no abnormal masses. Now we're going to go deep. Okay, once again, there's no abnormal masses. I'm going to get you to put your shirt down now. And there's one last test we need to do. We need to get you up and we need to check for a Romberg sign. So you have to be standing again. Alright, so what we're going to do is you're going to close your eyes and you're going to stand on one foot. And the same with the other. Alright, so you're negative for a Romberg sign and Holman sign. Is there any questions?
No.
Alright.